Hi, David Rosenberg here for the Psychopharmacology Institute. In this Child and Adolescent Psychiatry Smart Take, we're going to take a look at vaping cessation methods by U.S. adolescent e-cigarette users. And we know that vaping has become an international epidemic, and we recognize that there are significant health risks, both physical and emotional, with vaping, and knowing which interventions are being used by adolescents and which are effective is so important. And what the authors here do is they really do an elegant deep dive in terms of what are the methods that adolescents are using for vaping cessation and how successful are they. And we also know that a very large number of adolescent e-cigarette users do intend and want to quit vaping and have in the past year made quit attempts or attempts to quit vaping. And so what these authors did is they looked at current, that is the past 30-day e-cigarette users who had made one or more quit attempts in the past 12 months, and they examined data from the 2021 National Youth Tobacco Survey to examine the prevalence, associations, various demographic factors, social factors, vaping behaviors, perception of harm, and the adoption of various and different vaping cessation methods. And this was a large sample. They found that there were over 1,400 current vapers, and of those, just about 70% had made a past year quit attempt. And of those who had made the past quit attempt, over 60% reported that they didn't use any resources, what the authors refer to as unassisted quitting. Now, what were the methods that were in fact used in this sample? Peer support was one, help on the internet, a mobile app or text messaging, and parent support were the top 4 cessation methods. But remember again that the largest number of vapers didn't use any resources or what was called unassisted quitting. Now, there were some striking differences in both the success and the methods used. So, for example, female vapers were significantly less likely than male vapers to solicit parent support. Now, on the other hand, Hispanic vapers were significantly more likely to seek peer or friend support and parent support than white vapers. And there were also differences depending on the perception of harm that vaping could cause. So those who perceived vaping to be harmful were significantly less likely to get friend or peer support, but significantly more likely to use a mobile app or text messaging program. Dual users of e-cigarettes and any other tobacco product, that is, smoking cigarettes, were significantly more likely to get help from a teacher, a coach, or a doctor, or a health provider, and treatment from medical facilities than those who were only using e-cigarettes. And that may make sense because we know nicotine and other tobacco products obviously can have certain health risks, and just by going to see the pediatrician primary caregiver, there can be attempts, I think, since it's more recognizable, that is, using nicotine cigarettes or smoking cigarettes, that it may be more likely that doctors, healthcare professionals are going to try to intervene medically. So the bottom line is that there were significant and different correlates with the adoption of vaping cessation methods that adolescents chose depending on a whole host of factors: sex, male versus female, ethnicity, racial, such as white versus Hispanic. And what it really highlights is how critical it is to tailor and individualize approaches to meet the cessation needs and preferences of the adolescent vaping population. So there's no one size fits all. There's no cookie cutter approach that's going to work for all adolescents. And again, this takes high significance because taking a step back, for the most part, adolescents who so many wanted to quit and many made efforts to quit, most of them didn't use any of these methods. They tried it on their own, and we know that sometimes trying it on your own can be effective, but maybe one of the things we have to work on is how to make these interventions more accessible, more widely known, easier to get, and more user-friendly and more recognizable in the adolescent population. All very important, and I think we're in this new era because for many of us practicing, when we started practicing, there was no such thing as vaping. There have obviously been significant misperceptions regarding the safety or lack thereof of vaping. And now as we gain further knowledge and as more teenagers, adolescents are not only vaping and continuing to vape, but more adolescents perhaps are recognizing some of the problems with vaping and wanting to stop or making efforts to quit. It means that we have to be better equipped to meet that need and help adolescents stop this potentially very destructive behavior.